Leap cone biopsy is the most common and usually the most appropriate treatment for dysplasia that requires treatment. There are some other treatments that are sometimes used, and I wanted to talk about some of those treatments. The first is the cold knife cone, or CKC, and that's done when we really are suspicious that there's cancer. And the reason is that the leap, because it uses cautery, can affect the edges of the specimen, so sometimes the pathologist can't tell us how deep the pathology goes, how deep the abnormal cells go. Cold knife cone is done in a way that doesn't obscure the margins that way, and so we can get more information. So if we're really worried about cancer, a cold knife cone is generally what we'll do. And that's generally done in the operating room with you asleep, and basically a scalpel is taken and a cone-shaped piece is cut out from the cervix. That's sent to pathology. Those tend to bleed a lot, and so usually cautery is done on the bed, and then suture is placed to stop the bleeding. It's not uncommon to have a lot of bleeding after this. The other problem with cold knife cone is it can do some damage to the cervix and cause future problems in pregnancy, especially if you've had more than one of these. And so we try to avoid doing cold knife cones unless we absolutely have to, but in the case we're really suspicious of cervical cancer, that would be an appropriate treatment. Now, in the past, people have tried different things for dysplasia treatment, and one of the things that was really popular a while ago was something called a laser cone. And so when lasers first came out for medical treatment, people thought lasers were going to be the best thing for everything. And people were doing cones, but instead of using a knife or a leap, they were using a laser. Unfortunately, those scarred the cervix up terribly, and that's almost completely fallen out of favor. In my opinion, there's really no indication for a laser cone, and so if your doctor is recommending a laser cone, I would recommend that you get a second opinion, because that's really, in my opinion, at present time, not an appropriate therapy. The other therapy that's sometimes used is something called cryo, or cryotherapy, and that's basically freezing the cervix. And what's done then is a cone-shaped instrument is placed against the cervix, and then liquid nitrogen is run through to create a very cold environment, and it freezes the tissues of the cervix. That's then allowed to thaw and repeated, and generally usually done 3 times. Now the problem with cryotherapy there are several issues. One is it really hurts, and so unlike the leap, which is basically painless, cryotherapy is very painful and causes a lot of cramping. Number 2, it causes a horrible watery discharge, much worse than the leap does, and so the side effects from this are really pretty bad. It also tends to scar the cervix up so that if you have an abnormality again, it makes it much harder to see what's going on with a colposcopy, so it really obscures the cervix. It could also cause cervical stenosis, which can cause other problems. The other thing with cryo is because all you're doing is freezing and not collecting a specimen, you don't know exactly what you've treated, because you don't have a piece of tissue for the pathologist to look at the lab to make sure that there isn't any hidden surprises that you didn't know about. And the last thing about cryotherapy is it doesn't work as well. So it has a much higher failure rate than LEAP. So why in the world would anyone do cryotherapy? And the reason is cryotherapy is very easy to do, and it's very difficult to mess up. And so it takes a much lower skill set to be able to do cryotherapy. LEAP cone biopsy in somebody that's experienced is extremely safe, and having problems with LEAP cone biopsy is extremely rare in somebody that's experienced with the procedure. And so mostly OBGYNs are the ones that do LEAP cone biopsies. Most nurse practitioners, PAs, and even family doctors, although some do LEAPs, don't have the training to safely do a LEAP. And so if you're in a situation where you don't have an obstetrician, gynecologist treating your dysplasia, but rather a nurse practitioner or a physician's assistant, you're much more likely to get a cryotherapy because it's a lot easier to train someone how to do cryo. In my opinion, that's not a good reason to have inferior treatment. And so again, my recommendation is if you need treatment for dysplasia, you should seek someone out that can do a LEAP cone biopsy, because almost always that's the most appropriate treatment for your dysplasia.